Okie dokie. So thank you very much for booking onto this webinar, the first one that I'll be doing. I am going to be doing some monthly ones as well, I think. So always kind of keep an eye out and see if that topic's going to be relevant to you, or even if you just want to come along and have a listen, that's absolutely fine. So we're going to focus today on applications for 2027 entry. I will also be talking a little bit about clearing as well. And I have got some questions for those of you who, when you've booked on, I have seen all of your questions in the bottom of that form as well. So I'm hoping throughout the presentation, I will be able to answer some of those questions. But if not, there will be a Q&A session at the end for 15 minutes. So if you want to pop anything in the chat along the way, that's absolutely fine. I will touch back onto those questions if I don't cover it in what I'm talking about, if that's okay. So we will make a start. So what am I going to talk about tonight? So we're going to talk about what radiographers do, the entry requirements as well for the degree, typically, UCAS and personal statements, life as a student, interview preparation, clearing, a little bit about what to expect. And if you've seen on the social media as well, I will be kind of covering this a little bit more as the summer kind of continues. Career progression, and then obviously the live Q&A at the end. Okay, so I'll tell you a little bit about me. Oh, I've just turned my camera off. There we go. So a little bit about me. So I'm Hannah, and I am a qualified diagnostic radiographer, and I am also a mammographer as well. And I used to teach at the University of Salford in Manchester. So I know quite a few of you from all different parts of the UK. And I was a programme leader for the postgraduate advanced medical imaging programme as well. And I taught predominantly on the BSc Hons Diagnostic Radiography programme. So that was from level 4 all the way up to level 7 for the postgraduate study. So my qualifications are my BSc Hons in Diagnostic Radiography. I also have a PG cert in Advanced Medical Imaging, which is my mammography specialism. I also have a postgraduate certificate in academic practice, so that's my higher education qualification for teaching. And I'm also a fellow with the Higher Education Academy as well. So that's what all the letters are after my name. And I'm also the founder of Healthcare Academic Academy. So I launched this at the end of last month, actually, as I transitioned from my role as a lecturer. And I wanted to still do teaching, still do what I love, but I wanted to do it in a slightly different way. And I am actually relocating to Portugal with my family. So I am going to be fully remote, but fully dedicated to your success. So that means I am available anywhere worldwide as well. So that's just a little bit about me. So let's get into the nitty-gritty, because this is what we're here for. So what does a diagnostic radiographer actually do? So it's more than pressing buttons. So this is something that kind of really gets radiographers. If someone says, oh, you're just a button pusher, and you think, oh, well, it's been 3 years of training, and it isn't just pressing a button. So there's a lot more to it, okay? So there's a lot of patient care to do with diagnostic radiography. So you're the person that the patients see. Now, kind of 95% of the time when you're at work, whenever someone's in the hospital, 95% of the time they're going to see a radiographer. Now, I don't know how much you know about radiography itself and in terms of the hospital, but a lot of people just think in the hospital it's doctors and nurses. So frequently patients may call you a nurse, and you can just politely correct them and tell them that you're not. We are an allied health professional, okay? So we have direct contact with our patients. We have a lot of communication, but we also have to have compassion as well for these patients, because sometimes they are coming to us at a really vulnerable point. So I don't know if you've been in a hospital setting yourself as a patient. It is quite a vulnerable feeling. So we've got to make sure that, you know, we're aware of that and we can make them feel as comfortable as possible, because obviously we're in the hospital every day and it doesn't really affect us. So we can't let that kind of impact how we are with the patients, okay? clinical judgment as well. So in terms of the degree, apprenticeship, whichever way you go, there's a lot of critical thinking that comes with the whole examination. So in terms of every image, we are always assessing whether it's adequate, what are we seeing, and what happens next, and all the kind of stages that go with that. So we do a lot of image appraisals, understanding the anatomy in 3D. So obviously general x-rays are 2D images, so we have to be able to adapt and make sure that we understand the 3D concepts, how to correct positioning if things have gone wrong. It is quite a technical role, really. And radiation safety. So this is a lot of where the physics element comes in. So you are an expert in radiation protection. We have IRMA regulations. So this is something that you can definitely look up, IRMA regulations. And if you can kind of drop things like that in your interview or in your personal statement, you're going to get lots of top marks in that. We do a lot about dose optimization. So obviously when we are irradiating our patients, the risk of radiation can cause cancer. Now, the radiation that we use in diagnostic radiography is really, really low. And we have a principle called the ALARP principle. So that's as low as reasonably practicable. So we will always do the minimum number of x-rays that we need to do, but we need to do it with such a skill that we don't need to repeat the x-rays and then give the patients more radiation dose. So it's kind of having the balance of the risk to the patient versus the benefit. So dependent on what the patient has come in with. So for example, if they've been in a road traffic collision and you know there's a risk of fractures everywhere, then we need to make sure that we are doing what's right for them in terms of the x-rays, etc. But we also need to keep our patients safe. So we want to make sure that we are only doing the x-ray because it is justified for us to do so. Now, this terminology that I'm using is what is to do with the IRMA regulations. So whenever we do an examination, we have to justify that that can go ahead. And that's on us as a healthcare professional to do that. So a lot of the time, as radiographers, we can challenge doctors when they've put in these referral requests. We can say, well, this isn't justified. We are not going ahead with this examination. So we do actually hold quite a powerful role in terms of that. So you can read up a bit more about that in terms of IRMA regulations, dose optimization, and that sort of thing. Now, within diagnostic radiography, there is a lot of modality variety. I will go into this a little bit more later on, but just to give you a little bit of an indication, there's plain film, so that's your general x-rays that you see in A&E or through GPs, outpatients, that sort of thing. Obviously, you've probably all heard of CT, MRI, fluoroscopy, mammography, interventional, ultrasound. There's loads that come under diagnostic radiography. So what I would say is that no 2 days are the same. So it is actually a really interesting career, whether you stay within plain film and specialise in that area. So by that, I mean you can report on x-rays. So you can do a postgraduate qualification on reporting and diagnosing patients as well and writing up that report yourself. So a lot of radiography now is kind of taking on more of a advanced practice role. And that is whereby there is a lot of shortages of radiologists who are doctors and they've specialised into radiology. But what we have now are kind of band 7s, band 8s, who are then specialising and more or less can become consultant radiographers in their specialty. So it's actually a really interesting career and you have a really good kind of path going forward as well. So I'll demonstrate that to you a little bit on the next few slides. Okay. Now, I just wanted to add into here as well the difference between diagnostic and therapeutic radiography. Now, not only is this sometimes a question in interviews that they might ask you to check that you are applying for the right one, and it can actually throw quite a lot of people and they can't answer that question. And now I think it's really, really important that you know the difference between the two. Because we're both still classed as radiographers, we're both still HCPC registered, but there is a huge difference. Okay, so Diagnostic radiography, it produces images that help to diagnose injuries, disease. So there's X-ray, CT, MRI, fluoroscopy, mammography, ultrasound, and interventional radiology. We work across almost every hospital department. So any hospital that you go to, there tends to be an X-ray department or a radiology department. You will see us kind of everywhere. And we're involved in lots of areas as well. So A&E, orthopedics, we do a lot of theatre work as well in terms of orthopedics. So whether somebody's having a hip replacement, dynamic hip screws, so if they've had really bad fractures and they need metal work put in there, the surgeons do that under X-ray guidance. Now, a lot of people don't know that we do that, but the orthopedic surgeons actually couldn't do their work without us because they need to be able to see what's going on, where they're putting those screws when they are doing the surgery. We work in oncology as well. So, for example, obviously I worked in mammography. So that is a lot of oncology, breast cancer. But we work across paediatrics as well. So you can be a specialist paediatric radiographer. So you can qualify as a diagnostic radiographer, but then you can get a job in a children's hospital. And then you can specialise in just doing paediatrics if that's the way you wanted to go. And then obviously in maternity as well. So doing a lot of ultrasound scans and that sort of thing, that's focused on maternity. So we work in a whole host of different parts of the hospital. Now, our patient contact is quite often quite brief. So it's single appointments, it's very fast paced. We have a high patient turnover. It's typically a very, very busy department as well. So I'm sure most of you kind of know that the pressures the NHS are under at the moment, and in terms of the A&E departments, etc. So if you think about how many people are in A&E, and then I said at the beginning of the call, around 95% of people are going to come to radiology, that is kind of an impact on our department. So whenever you walk in, if radiology and A&E are looking really busy, we're going to be really busy, okay? So the career pathway, you start as a qualified Band 5 diagnostic radiographer. Now you can have a look on the NHS Agenda for Change and you can see what these bandings are in terms of your annual salary and that sort of thing. Obviously it's going to be different if you work in a private setting or if you take your degree or apprenticeship anywhere else in the world. So you can actually take our qualification and work anywhere in the world. Apart from the US, you would have to convert it. So there'd just be some slightly different additional things that you may have to do to become a rad tech, as they call it, a radiologic technologist. But other than that, you can go and work in Australia, you can go and work anywhere in Europe, which is a massive bonus in my eyes. So obviously from Band 5, you can then go into doing rotations around different areas within the general X-ray department, and then you can move up to a Band 6 or a Band 7, dependent on which area you go down, and be classed as a senior radiographer. Oh, let me just admit someone. There we go. And we also have consultant practice as well. So in mammography, for example, you can train to be a mammographer. So you would then be a Band 6 senior radiographer, but then you can go on to further specialties within mammography as well. So you can do ultrasound scanning of the breast, then you can do reporting of the breast, and you can do the stereotactic biopsies, they're called. So basically where we do a biopsy to check if that patient has cancer. Once you do those three things, you can then apply for a post to be a consultant radiographer. And there are other areas as well where you can do that. So entry typically for the universities is a BSc Hons Diagnostic Radiography, and it ranges from predominantly 3 years, but some courses are 4 years. Okay, so just check whereabouts you are and the universities you're interested in just to see the length of it. If you're starting off by doing a foundation year, then obviously that would be a 4-year course as well, because the actual BSc Hons is 3 years. Now moving on to therapeutic radiography then. So for therapeutic radiography, they plan and deliver radiotherapy treatment to treat cancer. So they use linear accelerators and targeted radiation doses. Now the radiation doses that they use are much higher because what they're aiming to do is kill that cancer. And to do that, they have to use a lot of radiation. Now you may see some patients, if you know anyone unfortunate enough to have had to have gone through that, you can have radiation burns and things like that. So it is slightly different in that they're treating patients, we're diagnosing them, hence the names. It's typically, when you're a therapeutic radiographer, you're based almost exclusively in an oncology and cancer centre. So they're not everywhere. So maybe not in your local district general hospital will you have therapeutic radiographers. So that's something to consider as well in terms of job opportunities and whereabouts your nearest cancer centre may be. Your patient contact's different as well. So it's often much longer term. So you're going to have the same patients seen daily over weeks and weeks of treatment, okay? So you build kind of real relationships with your patients. So some people prefer that aspect in terms of building that relationship. Some people find that quite difficult because obviously the situation is because they've got cancer. So you can see some really poorly patients as well. So it's just kind of for you to visualize each side of the career, okay? Now, in terms of career pathway, very similar. You'll be qualified as a Band 5 therapeutic radiographer, but it'd be treatment planning, brachytherapy, or kind of research specialisms. And then again, you can move on to consultant practice. So the actual entry for that is a BSc Hons in therapeutic radiography, or sometimes called radiotherapy. And again, it's 3 to 4 years full time. So just so you've got a really good indication of what the difference is between the two, because that is going to help you in an interview question. But it's also for you to kind of consider both sides of it, just to see if there's one that you prefer than the other. Okay. Excuse me. So what do I love about it? And what do I wish I had known? So, very honest version. So, what I love about radiography is the variety. No day is the same. No 2 patients are the same. No 2 shifts are the same. It's just always something different. So, it's not just sat at a computer 9 to 5 doing the same things over and over again. There is so much variety. You don't know what you're walking into. And I love that side of it. I find that really exciting. And if that's something that you like the sound of, then yeah, it probably is for you. Now, you are also making a real difference to these patients as well. So, and it's usually the most anxious part of their life. So being able to do that, I think, is really rewarding. I really like the clinical and the academic blend that comes with it. So even when you qualify, you still have a requirement to do continual professional practice, so CPD, with the HCPC. And what it does is it keeps your brain sharp. You always have to be working to keep your registration afterwards. But obviously, working clinically is just always keeping everything really sharp anyway. Now, the career doors that it opens as well, they are absolutely massive. So taking into consideration my journey, so I qualified as a radiographer, and I then specialised in breast imaging, and I then went into academia, and then now I'm setting up my own business, and I'm going to be starting my PhD in September. So my journey in only 10 years has done a full 360. So you can do that too. And it's just really nice to kind of envisage, where do you think you're going to be in 5 years' time? Where would you like to go in radiography? And what's the goal going forward? Yeah, so a lot of students do come onto radiography thinking, okay, well, I feel like this is the avenue I'm going to go down. So yeah, just something to think about. And that's personally what I love about it. Now, what do I wish I'd known? Now, placements are quite intense. They are physically and emotionally demanding. Okay, so you do need to prepare for it. I remember when I was in first year, I couldn't actually believe how much my legs were aching. And the radiographers mean it, and the staff, when they say you need to have a really good pair of shoes, like honestly, you really do. You need a really good pair of Hockers or whatever your hospital kind of support in terms of their uniform policies, but something really comfortable on your feet, because you are on your feet and it is really, really demanding. So I think that took me by surprise, and I don't really know why, but it just did. It was some long hours, and just because you're a student doesn't mean you're not going to do any out of hours work. You will be doing that as well. That's something else to consider. It is a job that's shifts, and typically you will be doing night shifts and you'll be working weekends. It can be 3 long days. that you do. Some places do like on call still, where you can take on more shifts if you want to. So there are quite a lot of hours that you do, particularly as a newly qualified. But as you kind of go into specialties, that's when your hours can go a little bit more stable as well. But it does depend on the hospital where you apply for a job, in terms of how their department works. So that's just worth asking the question. Now, the physics is harder than most people expect. Now, when you've got a good physics teacher, which most of the universities do, it makes it a lot easier. And if they can relate that teaching to clinical, it makes things so much easier for you. But I think it was harder than I anticipated going in there. I hadn't done an A-level in physics, and I was a bit like, oh. I did applied science actually, so I did do some X-ray physics, but it wasn't kind of to the level that it needed to be for the degree. But it's just something to consider. But obviously the teaching staff are there to help you if you don't understand anything. The sense of purpose you feel on a shift is unlike almost any other job. So I think in terms of, it's hard to explain really. You want to be helping people as much as possible, obviously. But I think sometimes what I found quite hard was that if someone had come in who was quite lonely, I'd want to sit and kind of talk to them all day, and I couldn't physically do that because of the amount of work that we needed to do, and we had to just keep going and going and going. And sometimes I found that a little bit difficult. But it's just learning that you can change your communication style and you can still give them what they need. And you just kind of figure out a way how to kind of get them out of the door politely, of course, to carry on doing your work, but still making them go out of that room and know that you've given them everything that you can and you've made them feel really comfortable and happy around you. What I will say is, obviously, asking for support is not a weakness at all. Asking loads of questions, that is where the best students are going to thrive, okay? If you go on to your clinical placement and you sit in the corner, not really engaging, then that's when people are going to withdraw from you and not want to help you. Whereas if you're really interested, really engaged, asking questions and getting involved where you can, even if, say, it's quiet, you can't say the dreaded quiet word, but if it is a quieter time, make sure that you're doing other jobs, okay? Just so you look like you're really, really into this and you're really wanting to develop. Or even if you just say to a radiographer, can you go through some X-ray images with me? Or can you help me with this? Can you help me with that? Or some terminology. Can we look at some request cards for X-rays? And can I learn how to justify them? That sort of thing is going to carry much further. Okay. So, entry requirements then. It's really, really difficult to try and capture this on a slide because obviously every university is going to be different, and obviously dependent how you're going about it. So I've done it predominantly for universities in the UK. Now, you need at least one science subject, okay? So most universities class biology, human biology, chemistry and physics as a science. Some universities accept psychology as a science. So dependent on where you're looking, you need to check if that's the case. Now, I know someone asked me a question about maths. Now, maths is rarely compulsory at A level, but obviously it is compulsory at GCSE level, okay? BTEC Applied Science, Medical Science and Health and Social Care Extended Diploma are accepted at many universities, but again, you do need to check the individual UCAS course page, okay? To check that the contents of it are okay. So sometimes the admissions team at the university will ask you to send over the course details in terms of what you're learning, and then they will make a judgment on whether they accept that or not, okay? So make sure you do that ASAP. So typical grade range, again, difficult to say, but typically 96 to 128 UCAS tariff points, or your A-level grades around ABB to BBB. Now, there is still some flexibility in this in terms of they may accept BCC on the day of results, but the entry requirement might actually be BBB. So there can be some flexibility. So again, just check the university that you're looking at, applying, and what the entry requirements are, okay? Because they do differ. Now, what I would say in terms of your UCAS application, when you have the option to have your firm and your insurance choice, your firm can obviously be your favourite where you want to be, but make sure your insurance choice has got lower entry requirements, okay? Just as a backup plan for you. Now, GCSEs, I'm assuming most of you have got these now because I think most of you are college students, but I'll just run through it quickly. So English, maths and science at a grade 4 or 5 minimum, and maths is required by almost all universities at GCSE, literally on most courses, okay? So just check the exact grade that you need. I had a question about mixed BTEC and A-level. That's absolutely fine. It's typically accepted by most universities and it won't disadvantage you. They'll just look at UCAS tariff points instead of kind of A-level grades, BTEC grades. They'll kind of combine it instead by UCAS points. Many successful applicants have a mixed profile, so just check your specific combination. But if there is a particular university that you're really going for, then get in touch with the admissions team and they will, reply to you in terms of if that's acceptable or not, if you're unsure. I'd say overall, biology is probably the most universally useful. Microbiology as well, chemistry and physics are all still valued, but obviously verify it with your university. Again, that's what I'm going to keep coming back to because it's really hard for me to capture it all on this slide. I had a question about gap years and universities as well. So healthcare work experience in a gap year is going to signal maturity and commitment to radiography, okay? There's no two ways about it. So if you search diagnostic radiography on a UCAS, you'll be able to find programs that you may not know about. So definitely do that in terms of the university choices. In terms of gap years, don't stress too much if you do have a gap year, and if you think that that's going to go against you in terms of your application. There's definitely things that you can do and that you can bring into your personal statement and into the interview that can demonstrate how that's helped you. I will touch on that a little bit as we go on. Right. So let's talk about UCAS and your personal statement, because obviously this is really important. So you've got to stand out in a competitive field. Radiography is really, really competitive to get into. There's loads of applications. So at my university, we used to get, I think it was 800 to 900 applicants, I think, for around, at the time, I think it was around 60 places. Now I know they've increased their capacity now to 95 places. But again, if there's still 900 people applying, it's still kind of a small pocket. So you've got to make yourself stand out. Absolutely. Okay. So in terms of the personal statement, it did change for this 2026 cycle. Okay. So the structured sections now. Now, I actually do think this is an advantage because it helps you to kind of put in exactly what they want. But it's just not one long essay now. So don't rely on online templates or anything like that because things have changed. So just make sure that you know what the 3 questions are that you need to cover on your personal statement. Now, I have got that on my social media as well. So do go back and have a look at any of those. Okay. So what's going to make you stand out? So specificity wins all day and every day. Okay. So you need to show that you understand the radiographer's role. That is so, so important. You've got to know what you're going into because at the end of the day, this degree is going to be your career going forward. Yeah. So you need to make sure that you show you understand that role like the back of your hand. So not just, I want to help people. Everyone says that. Yeah. You need to stand out from the crowd. We need to say something different. Link in your work experience to real skills, transferable skills to radiography, anything that you think connects and is transferable, put that in the statement. Okay. This is where I'm going to touch on the gap year. So obviously healthcare experience during a gap year can actually be a genuine advantage. Yeah. It's a non-linear journey, but if you frame it well, it shows purpose and it shows commitment. And sometimes coming in just a year or 2 after, which is what I did, is you're actually a lot more mature than those who are just kind of coming straight in. So it can actually be a massive benefit. Okay. So that won't go against you. So just something to to take on board. Now, work experience. Now, I know some radiography department at university, want you to have work experience, okay? And typically they want that in a radiology department. Now, I know that a lot of the hospitals in Manchester were really struggling to actually accommodate for the amount of people who were coming in for a day or two to see the radiology department. So I think now the kind of work experience is a little bit broader in terms of they just want to see that you've kind of had some caring responsibilities. So whether you've shadowed in any clinical setting at all, so anything where you've got transferable skills is going to be of benefit, okay? Any healthcare assistant work, any volunteering roles, care homes, GP surgery, ambulance trusts, anything kind of healthcare related, doesn't have to be the radiology department itself, okay? How are you going to write about it? We want to avoid any just descriptions, okay? Just describing isn't actually telling us anything. What we want to know is, what have you learned from that experience? How has that changed you as a person? And how is that skill transferable into you now going into radiography? Okay, so you need to describe what you understood from what you saw in that experience. What did the experience teach you about patient care? So was there anything in particular that someone did that really stood out to you and the patient took it in a really brilliant way and you thought, gosh, I never would have communicated like that. That is an amazing idea. Anything like that that's just gone like a click moment, you need to make sure that you put that sort of thing in your statement, okay? Clinical environments and obviously the radiographer's role as well. So just bringing in anything that's going to be transferable to your radiography role is going to be beautiful. That is what we want, okay? Now, if you haven't got much, the best thing to do is be honest. Don't fudge the statement and say, I've done all this and I've done all that, because it will just trip you up on your interview. You need to be as honest as possible in your personal statement. You need to know your personal statement like the back of your hand, because they're going to look at that and they're potentially going to change their interview questions specifically to you and what you've put on that statement. Now, if you've put something on there that you can't quite remember, it's going to trip you up and they're going to know about it. Okay, so just make sure, just don't lie. Just reflect on transferable experiences, whether that's part-time work, waitressing. So in terms of communication, that's a transferable skill from waitressing, okay? Making sure that you can do that, demonstrate that for part-time work, any caring responsibilities at home, for example, any sports, working as part of a team, that can be a good example, whether you're the captain of a football team or something like that. Any leadership roles in anything as well. Anything like that that is going to show relevant qualities that you were going to make a diagnostic radiographer and why we should pick you. Okay, right, work experience is done. So I'm going to touch a little bit on degree apprenticeship versus the traditional degree. Now, apprenticeships are kind of just coming in now. So when I did it, it wasn't really around, but we're seeing it a lot more now. So I just want to kind of tell you the difference between the two. Now, the outcome is exactly the same. So you're both going to have, both are going to lead to HCPC registration. Okay, so that's the Healthcare Professions Council registration. That is who we're registered with, and we have to always be registered with them. Otherwise, you aren't a radiographer. Okay, so that's what the whole degree is getting you to, basically, to get that registration. So similar to nurses have NMC, it's just the exact same process, but just this one's for us as allied health professionals. Now, your traditional university degree is full-time study. It's structured around placements. So it's usually 50% placement, 50% academic. Now, that kind of changes throughout the 3 years. So typically in first year, you're going to have more academic than you are clinical whilst we're building that knowledge. And then as you go into year 3, it's going to be much more clinical than it is academic, because we just need you on the floor ready to go to get a job. Yeah. Tuition fees apply. There is an NHS bursary though, to kind of assist with that, and student finance available. There's a wider choice of universities and locations across the UK with your university degree. So obviously if you're wanting to stay closer to home, there's probably going to be more chance of that in terms of the degree apprenticeship as it stands at the moment. The degree is the more common route, but only because it's the most well-known version. So that's not to say that the apprenticeship route's less common. It's just they don't have as many students on those courses, so it's just slightly different. Now, some university courses will have like a blend of the degree apprenticeship and the traditional degree students, okay? But obviously the avenues are just going to be slightly different and the way they work are going to be slightly different. But there may be some lectures that kind of cross over in terms of anatomy, for example. Both need to know anatomy, it's the same. So the degree apprenticeship then, so how does that differ? So obviously a positive is that you earn a salary while you train. There isn't tuition fees to pay for yourself. So that is a massive advantage, obviously. You're obviously employed by an NHS trust from day one. Now, again, that is a really good advantage. It's real workplace immersion. And obviously, once you finish the degree, there's no kind of applying for the job again. You're already in the job and doing it. So that is a huge advantage. But obviously, applying for the degree apprenticeship is going to be even more competitive because it's going to be a lot less spaces. So you've just got to figure out which avenue you think is best for you. So the routes are going to vary by trust and by region. So you're just going to have to really look kind of near you, like see where the closest is. Because obviously you say you live in London and there's an availability for a degree apprenticeship in Manchester, but obviously you're then going to work at that hospital in Manchester. So are you happy to relocate your whole life to be there? That's just something to consider as well going forward. So yeah, it's best suited to those who are certain of their local area, and if there's one like really close to you and it just fits, then perfect. That's a good way to go. But you've got to be ready to commit to that one employer. Whereas when you do the degree, you can have multiple placement sites. You'll get access to how different places work, like major trauma centres versus your district general hospitals versus your private hospitals. And then at the end, you've got a choice of wherever you want to apply, dependent on those 3 years experience. So yeah, it's just depends which avenue works best for you, really. But that's kind of the intro to both, should I say. So life as a student radiographer, that's what we want to know. So the real picture and what to expect when you get there. So it is a proper bachelor's degree, so a Bachelor of Science degree with honours. We cover physics, anatomy of the whole body, and we're talking 3D anatomy of the whole body. You will not believe how many bones there are in the body, but also all the little nooks and crannies of every little bone. You've got to know everything. You've got to know every single bit. Now that is really overwhelming in year one when you're learning all this anatomy, and I was thinking to myself, that is not going to stay in. How am I going to learn this? But you do. But I think we all have those wobbles at the beginning of thinking this is just information overload. Clinical sciences, and obviously we learn about pathologies as well, so it's so interesting. It's really interesting. Is the lecturer support? That was another question that I had. Yes, absolutely. There is lecturer support. You'll have academic personal tutors. You'll have module leaders. There'll be student support teams as well. There's loads and loads of support at university, so you won't be navigating it alone at all. Okay, so don't stress about that. You will go on placement quite early on. So from year one, I know we used to send the students out in November for a week, and it seems like, oh my God, they've only just started. But that was just to kind of get you a little bit ready, get you in on some e-learning and that sort of thing, just so you could do your commute and that sort of thing. But I think they've changed it now to a bigger block from January onwards, just so we can really focus on the academic. But now, like I say, every university is going to be different in how they do that. So when you go for open days and everything, have all these questions written down to fire at them and ask what we do. A lot of the universities have X-ray equipment as well, so you will do a lot of practical work at the university as part of your sessions, which is really cool. And I know some of them now are doing a lot of simulated work, a lot of simulated patients and that sort of thing, and that can kind of class as placement hours as well. So there's a lot of patient contact, real equipment and real responsibility as well. And study in abroad, yes, sometimes. So I know Leeds and Cardiff offer elective overseas placements. I know where I used to work at Salford, you could do elective placements in year 2 and year 3, and you could go wherever you wanted, but you had to fund it yourself. So obviously that's just something else to consider when you're a student. You think, well, I've not really got the money to go where I want to go, but the opportunity is there should you wish to do it. But you do have to ask each university individually, you know, which one is the best for you. Right, interview preparation. I need to talk a bit quick because we need to get to the Q&A. So what are interviewers really looking for? So they're not looking for the perfect answer, never. They're looking for someone who has got self-awareness, okay? You've got genuine motivation for radiography, and you can tell them exactly why you love it and why you want to do diagnostic radiography, and evidence that you understand what you're talking and what you're talking about and what you're walking into, okay? So there's some common question themes there. So why do you want to study diagnostic radiography? Why not nursing? Why not medicine? Why us? Why not physio? Why diagnostic radiography? Why this university specifically? Now, it's so important that you've done your research on that university, because they may ask you questions about that. And if you don't know how their program itself runs, it's going to go against you. So it's really, really important that you're looking at it as a whole. You need to tell them about your work experience, so they may ask you about it. So have some examples ready, written down, that you kind of know in your head, that you can kind of demonstrate some transferable skills, okay? They may ask you how you'll handle a distressed patient, and that might throw you really, because you might think, oh, I'm not on the course yet. But just being able to know how you would handle a distressed patient, an anxious patient, an aggressive patient, anything like that, just having an idea in your head when you walk in is going to be much more beneficial, rather than you being on the spot and going, oh, don't know, not thought about that. They may ask you what you know about radiation safety. So as I said earlier, talking about IRMA regulations, dose optimization, keeping the dose as low as reasonably practicable. All of those buzzwords are going to take you really far, okay? And what should you have prepared? So you should know your personal statement, like I said before, know your experience, have NHS awareness as well, because they may ask you some NHS core values. So that's just something to be aware of. And any questions that you want to ask them. That always looks really good. If you don't ask questions at the end, we think you're not interested. So definitely have some questions ready to ask them. Okay. So clearing, I'm going to touch on this. So again, I've touched on it a little bit on my social media. But what to expect. So on the 2nd of July, so that is Thursday, clearing's going to open on UCAS. Okay. Now, the chances of diagnostic radiography opening on that date are slim. I'm not saying it's impossible. It might be a possibility. But A-level results day is typically peak clearing activity. You want to be up early and you want to be ready to go. Your results are going to be there from 8 a.m. And then this is when the vacancies and everything are going to open. So you want to be on the phone to these people should you need it. Okay. So you have to have ready UCAS login and your personal ID number, your personal statement, but you should know it inside out by that point. You want to have your grades with you as well. And obviously just preparing for the interview questions. Okay. So they can be similar to the ones that we've just discussed, but it's probably going to be shorter and faster than standard interviews, and it's going to be on the phone. But you need to demonstrate the same core values. Yeah, you need to demonstrate motivation, patient care, and awareness of diagnostic radiography and what it is. So be ready to speak confidently about why you want to do the course. If you're on the phone and you mute, they're going to be like, right, yeah, we need to go now. We've got someone else calling. So you want to make sure you're the first one on there if you need it. So preparation still matters. Absolutely. So a list of universities with diagnostic radiography clearing vacancies will be available on UCAS from the 2nd. So have a look on there, see if there is any on there. But like I say, typically it comes around from results day. So maybe those who've had offers haven't reached the entry requirements. So now spaces have become available. Okay. So just something to consider. Now, in terms of what separates strong applicants from the rest? These are from my experience. So when you are calling without your grades, your UCAS number, your personal statement, you're just coming across as unorganised. Are we going to want you on the course? Probably not, because you're not demonstrating kind of a good starting point. So make sure that you're applying for the courses and you absolutely know, you know it like the back of your hand, you know radiography like the back of your hand. If you sound unprepared or if you're unsure why you want the course, again, like I say, they're going to have loads and loads of people on the call waiting, and they're just going to say, right, next, okay? So you want to make sure you're making an impact, even if in that short amount of time. So waiting too long to call as well. So like I say, the grades will be there from 8 a.m. If you hadn't got your firm or your insurance choice, you need to be on that phone at 8 o'clock to make sure that you're that person who's going to get on these other programs, okay? Because popular courses will fill up quickly. If you leave it till 1 o'clock in the afternoon, they'll be gone. Absolutely, they'll be gone, okay? And obviously having only one backup option in mind, just make sure you have got, you know, if this is really what you want to do, you've got a few backup points. And to go further, so beyond webinars and research, you want to arrange some direct work experience or shadowing if you haven't done already. Read current NHS and imaging news, look on the Society of Radiographers, and a lot of social media cover kind of imaging news and that sort of thing. So you want to show awareness of this, of like recent activity in interviews. So this is relatable in clearing or in general interviews. You want to practice speaking your answers out loud, so not just thinking them. It's surprising how you can think about something really well, but then the minute you ask something on the spot, you can't speak and you freeze. So you want to make sure that you have practiced that, whether that's talking to yourself in the mirror, as awkward as that is. It is a really, really good way to just help you to get much better with your communication. Get someone to review your personal statement with fresh eyes as well, because sometimes if you've just looked at it over and over and over again, you can't see obvious mistakes or you can't think about anything else. So sometimes just getting someone else to look over it with fresh eyes is going to make a hell of a difference. And make sure you visit an open day or a virtual tour if you haven't done so already, because it will give you so much more information. So where can this take you? So I've touched on this already. So this is just, you know, an image kind of difference of it. So go from band 5 to band 6 to band 7, an advanced practice consultant. That can be band 8A, 8B, 8C, dependent on what it is. So like I said, have a look on the NHS and you'll see the kind of different scopes and what they are. And they're all the different specialisms that you can pursue. So reporting radiographer, you can go into academia and education, AI and digital health. You can go into all sorts of roles. You can be an application specialist where you go into the hospitals and train people on all the new equipment and that sort of thing. So there's so many avenues that you can go down. It's literally, the list is endless. So that's why it's such a good career, really. Oh, well, I need a breather. So live Q&A then. So have any of you got any questions? I don't think I've seen anything come up on the chat. So have a think about any questions. I've tried to capture most of your questions within my PowerPoint where I can, but I know there's a few people who kind of booked on last minute, so I may not have captured your question. So please do take a minute to ask me some questions. Oh, thanks, Mariam. Let me have a sip of my drink. So what made me want to